Good afternoon and welcome to the University of Southampton and welcome to Cardiac Physiology. My name is Dr. Richard Bain and I'm the Programme Lead. And I'm very, very happy to welcome you to Southampton to our very, very unique teaching facilities that we're going to show you today, along with some demonstrations and meet members of the team. So to start off with, then, let's introduce you to some members of the team. First up, I would like to introduce Dr. Sally Sampson, who is a respiratory physiologist as well as our placement lead.
Good afternoon and welcome to our open day at Southampton.
Thank you, Sally. I would also like to introduce you to Emily Clark. Emily is a graduate from the programme and is now a Band 5 cardiac physiologist working here at University Hospital Southampton.
Hi.
Thank you, Emily. Next to introduce you is Amy. Amy is a Year 2 student who is just about to embark on her second year of studies on Monday morning here in Southampton.
Yeah, hello.
Thank you, Amy. So, also online, you can't see him, but Dr. Graham Petley is also there behind the scenes working on the Q&A sessions, so he's part of the team as well. Where you can see me at the moment, hopefully you can see all this. This is our dedicated classroom that we use to deliver all the theory. As you can see, our tables are socially distanced, we have hand gel, students are scanned in, so we conform to all the health and safety issues that have come as a result of COVID, and of course we're in a hospital as well, so we adhere to all the hospital rules and regulations. So we like to keep you safe while you're with us. Now, what's unique about this room is that it's ours. This is a dedicated teaching space only for cardiac physiology. And we're very, very, very lucky to be having this here in the hospital. And as you can see our room, you've seen our tables where all the students sit for their studies. We've got obviously our projector here. And we use this room in multiple ways. So we've got formal lectures going on here. Well, the reason why you see all the desks like they are, because we can move them all away and use the room as a clinical skills room as well. So this room doubles up as a teaching room as well as an additional skills facility that we have here at the hospital. Now, what's very important about this, of course, is that we deliver all your formal specialist lectures here, and then the idea is that they will then take you from the classroom, which we're going to do now, and Sally's operating our trolley very, very well. We literally deliver all the lectures here, give you the information you need, and then we're going to take you through to our dedicated skill facilities, as long as Sally doesn't trip over the door tread. Thank you, Sally. So this is us coming out of what we call AB63, and this room, we're very, very lucky, as I said, it's ours permanently for the programme. And it becomes home with the students basically for the 3 years of the programme. And here we are in South Academic Block of the hospital. But now we're coming into what we call AB62. And this is our skills lab. And this skills lab is set up as a cardiac department. And it's so unique in terms of its features, of course. The cardiac department actually moved in here during COVID, and they used it as a cardiac department. Okay, so we've shown you a little bit of our facilities and our teaching space. What I would like to do now, if I may, is give you a short talk about the programme itself, and then we'll move on to some of the demonstrations and things like that. Okay, so if you came to Southampton, you would be studying a BSc Honours in Cardiac Physiology. And it is a science degree, of course, so we have to bear that in mind, and of course we are looking for people with an interest in science. Here's a summary of the programme for you. So if we look up in year 1, you can see that you'd be studying cardiovascular, respiratory and sleep physiology. You also have to start being prepared for professional practice because you're also trying to become a healthcare professional. So you have a module on professional practice. There's some generic modules that will teach you a little bit more about anatomy and physiology, and of course that's about main body systems that you have to understand and fundamental physiology within the body. A key one up here is work-based training. And of course, that's where this skills lab comes into its own. Work-based training, this is you out on a clinical placement in a department. Year 2, you're specialising in your cardiac physiology, we call that non-invasive cardiac physiology, which we'll go into in a bit more detail shortly, but that's a specialist module. Year 2, you're studying research methods, which is where you learn how to carry out a research service evaluation audit, that type of activity. And that's very, very important because you'll put that to use in year 3, and you'll see why shortly. You also have a module called signal processing, and that's very physics orientated because you have to understand that how the equipment that you use, how it works, how it functions. So part of being a cardiac physiologist, you need to understand when you're looking at results, whether you believe them, you don't believe them, is the machine wrong? We don't just act on numbers, we have to look at the equipment as well. We've got a module on public health, which will look at the bigger picture of people with cardiovascular disease, looking at it from a global perspective, looking at it from a national perspective, looking at the demographics of the country, and look at some of the causes behind it. And of course, you have another work-based training module, which again is when you go out on placement, where you've developed your skills further and you're performing more and more investigations regarding cardiac physiology. In year 3, this is where you work towards your invasive cardiology. So these are procedures that invade the body that you get involved with. And you've got another module there on professional practice. So that's developing you as a healthcare professional and looking going forward about becoming a leader and leadership within the NHS, becoming managers. Here is your research project. If you remember, I told you about the research methods. So the tools that you use in research methods, you will use in your research project. And it could be a piece of research, it could be a service evaluation, it could be an audit. And that will be performed while you're on your 3rd year placement, which is your long placement. And Sally will go into more about placements in detail. But what you can see here is you gradually go from your small placement, work-based training, with just a couple of skills that you learn, and throughout the 3 years you're building up your repertoire of investigations that you'll be able to perform on placement. Okay. Lecturing staff, so we've introduced you to some of them already. So you've mentioned Sally, who's a respiratory physiologist, and she is involved in teaching you specialist modules in year 1. She's involved in public health, and of course she's involved in placements throughout the programme. And she's also a personal tutor to students. Ground background is medical physics and clinical engineering, which is very, very important. I'm a cardiac physiologist. Other people you'll get taught by on the programme, some of the shared modules, will be allied health professionals and researchers. So you are getting taught by a range of people, but more importantly, when you're doing your specialist modules, you're being taught by specialist people. Okay, this is people that have been there, done it in terms of working in NHS and being a physiologist. So you get lots and lots of experience. Now, because this is a national programme, of course it has to be accredited. Yes, it gets accredited by the university, so you get your degree, but also it has to be accredited by the Academy of Healthcare Science, and it has to be accredited by the Registration Council for Clinical Physiology. And what's really important about that for you is because when you graduate from your programme, you can register with these bodies as part of being a healthcare professional. So that's really, really important about the accreditation of our programme. So what do you need to get into this programme? Well, hopefully you can see the slide here. Typically we're looking for something like ABB, and we want a science in there, you know, some biology, some physics, some chemistry or something like that. Because as I said when I started this talk, it is a science degree. The ABB or equivalent. So there are a host of other qualifications that we would consider, but the bar is around ABB, and that's the sort of equivalence we'd be looking for regarding getting into this programme. Now, something that's also very important for us, everything we do as a physiologist involves people and patients. Every investigation we perform, there is a patient attached to what we're doing. So good communication skills. So any experience you have working in the public sector, whether you're volunteering in a charity shop, whether you're working in McDonald's or whatever, it doesn't matter. Other outlets are available. I think I'm contractually obliged to say that. So don't worry about where the work experience is. The fact is that you're having some is invaluable. Okay, so that's about what we need to do to get in. What we're going to do now is hand you towards Emily, and Emily is going to be performing what we call a transthoracic echocardiogram. Thank you very much.
So I'm going to be performing a transthoracic echocardiogram on this gentleman. So this test looks at the structure and the function of the heart. So if you can just turn onto your left side for me and pop your left arm up in the so roll back a bit towards me. Yeah, that's lovely.
Okay, so what you can see here is Emily's performing a transthoracic echocardiogram, and of course, if you look at this, this is what I'm saying about good people skills, good communication skills, because you do become quite intimate with the patient during this procedure. So what we're going to do is, while Emily's scanning, so transthoracic, as in we're using ultrasound to transmit into the heart, it will bounce off structures and we get an image back. And now what I'm hoping to do is Sally will zoom in on our pictures and I will point out what we're looking at. So this is what we call a parasternal long axis view, and what we're looking at here is this is the patient's left ventricle. So I can see the septum and the posterior wall, which is moving fine. I can also see here this structure here, which is the left atrium. And between the left atrium and the left ventricle is, of course, the mitral valve. And what I can see here, I can see that the anterior and the posterior leaflets are thin and mobile, and they're working correctly. Above here, this valve is a semilunar valve, and this is the aortic valve. And of course, that aortic valve is connected between the left ventricle and the ascending aorta. So when the heart's contracting and pressure exceeds the pressure in the aorta, the aortic valve will open and eject blood into systemic circulation. Okay, while Emily's doing that, I am going to show you some other images so we can take some measurements from our scan, but we can also zoom in. So this image we've got on the screen at the moment, this is a zoomed in image of our left atrium here, our aortic valve here, and our mitral valve here. So we're zooming in here. So this is the upper end of the anterior septum, and I've got the right and the non-coronary cusp of the aortic valve. And again, I can see those valves, those leaflets are moving free and mobile, and this is what we call the sinus of Valsalva, and this is this bulbous structure, and that's important because that's where the ostia of your coronary arteries are. So this is what we call 2D imaging. Now, just to show you some other images while Emily's scanning there. Okay, what we can do with our image there, that's it, fantastic. We can put what we call colour flow mapping on. And colour flow mapping is a form of Doppler, and it shows us blood velocity and direction. So we can see if a valve is competent or incompetent and whether it's leaking a little bit. Fantastic. Thank you, Emily.
There we go.
Now, just to show you one final picture that Emily took there. This is a short axis view, and what we can see here is the LV in short axis, and here is our mitral valve. And it looks a bit like a fish's mouth. So what we need to do with transthoracic echocardiography is look at the heart from different angles, because obviously the heart is a three-dimensional organ, and we have got a two-dimensional imaging system, so we will look at other views of the heart. So this is a parasternal short axis view. And what we're doing here is we're scanning the heart at the base of the heart. So earlier I showed you the aortic valve, and now I'm showing you the aortic valve in the parasternal short axis view, and now I can see all three cusps of the valve thin and mobile. Okay, so that's important for us, and we would do some other measurements as well. Now, some of the other images that Emily took here, we're just going to show you. Okay, just want to come back to a different image. So this one might be a bit more easy to understand. This is what we call an apical view. And an apical view, so our probes here at the chest is transmitting up through the heart, and here I can see the left ventricle, I can see the right ventricle, here is the right atrium, here is the left atrium, and here's the outflow tract of the aortic valve, and here's the aortic valve there. So again, we can do 2 dimensions, which we're using, and we can take measurements. We can visually see and compare sizes because we expect the LV to be bigger and larger than the right side of the heart. And we can also do some Doppler, which we mentioned, and that will look at valve competence and stenosis picking up for valve and heart disease. And of course, sometimes as well, we see things outside the heart, which is very, very important as well. So a transthoracic echocardiogram. Your patient's on the left side. What you probably couldn't see in the image there was the patient had their arm outstretched just to pull the ribs apart a little bit, and we had the probe pressed against between the 3rd and 4th intercostal space. And then what Emily was doing there while she was taking those images, she was manipulating the probe to bring in and out some of the images. And this is a standard test that is performed on lots of patients day in, day out, keeping an eye on their heart. Structure and function is the important thing. Okay, so what we're going to do now is hand over you to Emily and Amy, who are going to talk about some of the other investigations that we perform as cardiac physiologists. Thank you.
So in year 1 of the programme, we learn to do a few basic skills that we develop on throughout the years. So the first skill is the 12-lead ECG. So we use this machine here and these leads, and we attach electrodes to the patient's skin and connect the leads to those, and then we get to see a trace of their electrical activity in the heart. We print one of those off on the machine, and it comes out like this, which is an ECG. Not only do we have to take the test, we also have to interpret the results. So this ECG here shows sinus bradycardia, which is sometimes normal for some patients. It's just when a person has a particularly slow heartbeat. So for example, someone who does a lot of exercise might normally have sinus bradycardia because their heart is bigger than a normal person's.
And then another result from an ECG that we have here is an ECG of a person who is having a heart attack. So from this ECG, that we'd be able to interpret this and know that we need to get more senior help, and this patient needs to go to the cath lab. So as you go through your like 1st, 2nd year, 3rd year, you learn more complex skills to interpret this, and then actually in your 3rd year, you'd be involved in patient management of a heart attack.
Another skill that we do in 1st year is a manual blood pressure. So we use this bit of equipment over here called a sphygmometer, and you have a cuff on it, and all you have to do is you put the cuff around the patient's arm, and you use a stethoscope to listen to an artery, and you inflate the cuff and deflate it whilst listening to the blood through the stethoscope, and then you read off the results of the blood pressure. So that's also a skill we do in year 1 when we go out on placement and when we're practicing in the skills lab.
And another skill that we learn in our 2nd year and 1st year is how to apply ambulatory ECG monitors. So patients can wear these from 24 hours up to a week. So the ECG only collects 10 seconds worth of data, and obviously this can collect up to 7 days worth of data. And then this data is then analysed by physiologists, and the results will go off to a doctor to decide on their patient management. And we also have different types of ambulatory monitors, and this one can be worn for up to a month.
We also do have to learn basic life support. We have to be assessed on this throughout the course. Because we are cardiac physiologists, we do need to know like chest compressions and basic life support in case of an emergency in the department. So that's what we use these dummies for. And we do all these skills in skills weeks, which lead up to our clinical placement, where we get assessed on these skills. And Sally is now going to talk to you about clinical placement.
Yes, so I'm just going to run through placements and where they fit into the programme. But before I start doing that, can I ask you, if you're listening and if you've got any questions, do feel free to start typing those into the chat now, so that we have a chance to get through them all and answer all your questions by the time the session ends. So if you can be typing while I'm talking. But as Amy was saying, placements are integral to our programme. So the time that you spend at university, you're learning both theory, you're learning the academic side of cardiac physiology. Together with, we're teaching you practical skills in this wonderful skills lab. So you've had the opportunity to practice those skills on model patients that we bring in for your practical sessions. But that culminates with you going out on placement, and you will go into a hospital, into a cardiac department, where you will be allowed to observe and to actually test patients who have come to hospital. So if we look at this slide here, this shows where the where the placements fit into our programme. So over the entire 3 years, you have a total of 50 weeks that is spent out on placements. And in the first year, we spend some of the time in the skills lab here, but then your first placement in a hospital is the January of your first year, when you'll spend 2 weeks in a hospital out on placement. And that placement is purely observational, and it's to give you the opportunity to see how a hospital department works, and to see how a hospital as a whole works, and how cardiac physiologists fit into the NHS as a whole. So in that time, you may get the chance to test patients, but you'll also get the opportunity to see other techniques. So you may even go into a cath lab in your very first time on placement, because the departments are really keen to show you what their departments offer and the range of tests that are encompassed by cardiac physiology. So those 2 weeks are really important in giving you that broad view of cardiac physiology, and you haven't got any sort of responsibility in collecting data or anything such as that. You then go back to university, and you'll spend the rest of that academic year at university. But at the end of May, you will then go back out on placement. And this is for a 6-week placement. So it's a nice solid block of time that you can spend in a cardiac department, and you will be performing tests. So in the first year, the tests that we would be expecting you to perform, and you'll be collecting evidence for this. So you'll be collecting copies of the ECGs that you've performed and to put into your portfolio. But the tests that you'll be performing would be ECGs. You'd also be performing manual blood pressure measurements on patients, and also those ambulatory devices that our students were just showing you. So ambulatory ECGs and ambulatory blood pressure monitors. So you'll be applying those to patients so that they could go home and be monitored at home. Now, the other really important thing to know about placements is that all our placements come with academic credit, so that while you're on placement, we're not just expecting you to go out there, go into a hospital department and then just come back again. We give you, it's very structured in what you need to do while you're on placement. So I've talked about collecting evidence, so you will have to perform a minimum number of tests and collect evidence for those, so as you build up a clinical portfolio. And that's really important because that's something that you can build on. Each year you will produce a portfolio, and those are really useful not only for your own development, but once you're qualified and you're a qualified cardiac physiologist, you'll be able to use those portfolios as a resource to help you when you're training future cardiac physiologists down the line. The other thing to note is that we're saying you're producing these portfolios, but all the time that you spend on placement comes with academic credit. Now, to explain that a little bit, when every module that you take as part of your degree programme has a certain number of points that count towards your degree, and that's also true of the time that you spend on placement. So in the first year, for example, fairly short placements, it's 10 weeks in total, there are 7.5 academic credits, they're called ECTSs, that go towards your degree. In the second year that builds up, it's a greater number of credits, and then by the time you're in the third year it counts for 30 academic credits, which is half of the year's worth of credits. So it's an important constituent of your degree programme. Looking back at this slide here, you can see that in year 2 you spend a longer period on placement, so you're going to be spending 15 weeks in total on placement, and in year 2 you will have learned further skills that you'll be putting into practice once you're in placement. Year 2 is all about non-invasive procedures, so in addition to the ECG and blood pressure and ambulatory devices, you'll also be doing, for example, stress testing, whether that's treadmill tests or stress echoes. And then we come on to year 3, and you can see year 3, you don't spend that much time at university. You come back after your summer break in the second year in the October, and we bring you back a little bit earlier, just because there's so much to get into the academic side of the programme, and you're with us up to the Christmas time. After Christmas you'll have an assessment, and then you're sent out for that 25-week placement. So that's a really long time that you're going to be spending in a hospital department, and you'll really begin to feel like one of the team in your time there. And the third year, of course, it's not only the non-invasive side of cardiac procedures that you'll be involved in, you'll also be involved in invasive cardiac procedures. So that means that you'll be in the cath labs where procedures are being formed, and you'll also be involved in patients having pacemakers implanted and following up those patients so that you can adjust the pacemakers. So you're really involved in the patient pathway. Okay, if we come on to the next slide. This is just a slide showing you some of the locations where our students may go out on placement. So we aren't confined to just hospitals around the Southampton area, we go across the UK. So over the past few years we've had students who have gone as far as Plymouth in the west, as far as Blackpool in the north, and right over to Hastings in the east, and probably because of Cambridge is almost as far east there as well. So we talk to students and we try and work out what their preference for a student placement will be. Do they want to be somewhere close to their home, or do they want to go somewhere they've never been before that they think might be interesting, or they've heard good things about the hospital? And so we discuss with the students and try and find an opportunity to send them on placement somewhere that they've chosen to go. So we have a lot of hospitals close to Southampton, so we send students in Southampton itself, Portsmouth, Chichester, Basingstoke, Salisbury, Bournemouth and Poole are probably our closest cohort of hospitals that we send students to. But we've also got students, as I say, in Coventry, in Oxford, Papworth Hospital, Royal Free in London, King's College Hospital, and another range of hospitals across the country. So if you can't see there somewhere where you live and you think you might like to go on placement if you are going to train as a cardiac physiologist, then always talk to us about that, because that's something we can try and develop. So if you live somewhere, for example, Norwich on the map here, we would get in touch with the hospital and see if we could organise and develop a placement opportunity for you there. As I say, a large proportion of the programme is spent on placement. It's 50 weeks out of your 3 years. So in essence, it's a whole year that you're spending out there. That's why placement is so important, and you're getting to practice and hone all those skills on patients. Okay, I'm now going to move on from this and talk a little bit about career opportunities. So what happens when you qualify? Well, this programme is known as the PTP programme because at the end of it you will be a practitioner. So that means that you will join the NHS on the pay scales. You will join as a band 5. Now the pay scales range from 2 all the way up to 9, I think. So you're joining fairly in the middle. And that's because you've got a BSc honours degree that allows you to start as a band 5. You can move up those bands, so every year there's the opportunity for the pay to increase. And if I move to the next slide, oh no, I've gone up too far. I'll talk about that in a moment. So at the moment we'll talk about where our students are employed. And one of the fantastic things about becoming a cardiac physiologist is that you're highly in demand, and all our students, all our graduates for the past 3 years, as I can think of, have been employed before they have actually graduated from the programme. So I think this year the students who have finished their placements in the summer now and will graduate in December, one of our students was offered a job in her first week of her 3rd year placement. So when she finished her placement, she went straight into an employed role in the NHS. We say all our students are employed and sought after by hospital departments. And you can see from this map here, again, a spread of where our students have gone to work. So they're not all just staying close to Southampton, they're spread across the country. So again, we've got students in Plymouth, in Coventry and Birmingham, in London, and all across the south coast. So they're spreading far and wide. And in fact, students are even going, I think we've got somebody up in Blackpool now as well. So the opportunities are endless. I say most hospitals will have a cardiac department and they all need cardiac physiologists. So as you can see, these are the pay scales that I was talking about, going from band 1 to band 9. So this is the important thing your parents will be interested in is, you know, is there a job at the end of this degree? And the answer is most definitely yes. And in the NHS, when you start on a pay scale, there is an automatic progression through the pay scale. So, for example, band 5, starting salary around 24,000. I think it's actually increased a little bit this year. Yeah, yes, our recent graduates nodding, so a bit more than that. And you will progress up to the top of that pay scale if you stayed at that band. But there are enormous opportunities to progress. So students or qualified cardiac physiologists will normally spend just a couple of years as a band 5, and then they will be promoted to a band 6. You see the starting salary for a band 6 is considerably high. So there are lots of opportunities here to move through the scales, and students who have been on our programme, and the programme's been running for about, I think we've had 10 years of graduates, we have students well into band 7 now. Okay. So What are the good things about being a cardiac physiologist and working for the NHS? Well, I'd say one of the best things about being a cardiac physiologist is you'll never have a boring day at work. Every day you go in, you will see different people, you will be doing different tests, you will be seeing different results. You never know what you're going to see, so your day will never be boring. And there are enormous benefits for working for an organisation like the NHS. So there's a very structured career pathway. So once you're qualified as a cardiac physiologist, your department is really keen to keep you. And there is a very defined sort of career progression that's available to you. You may not be thinking about this at the moment, but your pension will be important to you one day, and you're automatically enrolled into the NHS pension scheme. There's also sick pay. You will get annual leave, and the amount of annual leave you get increases the longer you stay in post. And there's also the opportunities for flexible working. So a lot of cardiac departments work on long days. So it means instead of working 5 days a week, you work 4 days a week, but you start at 8 and finish at 6. But it does mean you get a 3-day weekend, which is great. There's also opportunities for people to come back part-time. So a lot of people will want part-time opportunities at certain points in their career, and the NHS is usually very flexible and sympathetic to people who want to work part-time hours. Okay. And another thing I just want to say, it's not all hard work, we have fun too. So these are pictures for, I think, the last 2 years, well, not last year because of COVID, but the years before that, of our Christmas quizzes. So every year there are Christmas quizzes, and every year we ask our students to come in a Christmas jumper and we have a fun Christmas quiz. But I'm finished talking about the students. What I'd like to do now is pass over to our students, and we will ask them to have a chat about how they've experienced student life and what it's like as newly qualified physiologists. So over to you, Emily, please.
Yeah, so I've just qualified in July as a cardiac physiologist and gone into a Band 5 role, actually here at Southampton Hospital. And I was here for my final year placement, so it was a quite nice kind of movement in transition, that's the word I was looking for, into the job role, already having been in there on placement. I think maybe the one thing to say about having just qualified, you're not suddenly just on your own. As soon as you qualify, you will be with people. You're not just left on your own, and you'll be with people until kind of you're confident enough to be on your own and signed off. With the job role, I think departments nowadays are looking maybe for people if they've developed a special kind of interest or particular liking for one of the areas, maybe invasive or non-invasive. Departments are quite open to you going down one of the routes, so the invasive, the echo, the stress testing. Personally, I like the invasive side, so I've decided to go down that route. But if you don't know, it's not a pressurised situation. You can stay quite general as well until you come to a point where you decide, oh, actually, I like that, or maybe I want to stick with everything. And you can do all the tests. Any questions you'd like to ask me having just qualified, or?
Did it feel different because you went almost straight away into your full-time post, didn't you? You finished how long a gap did you have?
I had quite a nice gap. Yeah, I had about 7 weeks off between finishing and starting, which most places they'll know you've worked out for your degree and then give you some time off before you go back. So yeah, I had a good amount of time off to refresh before I was ready to go back into the position as full-time. And like as Sally was saying, I'm actually doing 8 till 6 and then you get a day off in the week. So they do allow for like flexible working. And I think that day off in the week really does help for having working kind of longer hours. And having just finished the programme, I can say that the skills lab, all the lecturers that you get taught by, who a lot of them are physiologists themselves, it does prepare you for for graduating and going into a full-time position. I think if we didn't, before you actually go out on placement, you've probably already performed well over 50 ECGs and stress tests, and they give you clinical scenarios which prepare you for going out on placement. And they don't just look at your your skills and competencies. In your third year, they get heads of departments in from around the area, and they do mock interviews with you. So they're not just looking at your skills; they're also helping you to prepare for when you go for job interviews in your final year. And that you have to come in like a proper outfit that you would for a job interview, and they put on it's a a real scenario. So they do look at all of you and not just we need to pay placement and that's kind of it. I don't know if you've got any
Yeah, so I've just started my second year of the course this week. So at the moment we are doing lectures for various different modules. We've got a research methods module, a non-invasive cardiology module, and an instrumentation module. So there's a lot of variety throughout the week, which keeps things nice and interesting. So you never have a dull day, as they say. We then do some skills weeks in the first term of year 2. So I think in a few weeks we've got our first practical skills session to recap the skills we've learned in year 1, which is the ECG and manual blood pressures, ambulatory monitors. So that's really nice that we've got that pretty soon, so that we get that recap refresh since we've had a long summer. Me, this year I've moved back into the halls of residence with a group of girls off my course. So we're moving in for 2 terms as we go out on placement, like Sally said, for the last term. So after Easter of second year, we're on placement. So I'm only staying in Southampton for 2 terms. So that's really good that the halls of residence allow that flexibility around that. So you don't have to pay for a longer duration than what you're using, which is really useful, especially when you're a student and you're trying to save some money. Life on campus is starting to get back to normal now. It's a lot busier than last year because of the COVID restrictions have started to ease. So for us this year, we do have a mixture of online learning and in-person learning, which I think is a nice mixture. Some days you get to stay at home and watch online lectures, go at your own pace, and other days you do have to come into either campus or the hospital, and you get a lot of one-on-one learning. Then you get the opportunity to ask lots of questions and have a catch-up with your course mates, which is really, really nice. Our cohort is quite small as well. We've got a small course, which means that you get to know everybody really, really well. Everyone knows you by name. All your lecturers know your weaknesses and your strengths, what you might struggle with, and then they can provide that extra support for you as well, which I think is really, really nice. We've got lots of clubs and societies as well at Southampton. Last year, due to COVID, I didn't join any society. I just joined the gym. Jubilee Gym has badminton courts, tennis courts, swimming pool, gym facilities, squash courts, a lot of variety, something for everybody. But this year I am joining the running club for the university, so that will be something new to try. So I encourage every one of you to join a society or a club. There's over 300 societies, so there's something for everyone. Recommend you just trying something out. It's a good way to break the ice and get into university life. So yeah, did you do any clubs or anything?
Yeah, I did the running club. I did athletics. So yeah, it's a really good way to meet people obviously outside of your course too, and they do a lot of events. So there's always something to get involved with. I think a lot of clubs and societies as well do maybe obviously before COVID trips away and things like that. So there's plenty of opportunities to get involved with lots of activities.
I come and ask you some questions?
You can, yeah.
I was going to say, do you have any sort of social events within the programme itself? Do you mix between the years?
Yeah, so well, personally, I thought when I was on the programme, we kind of, every year we do a Christmas meal and try to get all 3 years at the Christmas meal. That's a really good, kind of event to get everyone together. And I think when we have a buddy system as well.
So how does that work?
So the buddy system, so if someone was in the year above, you get a buddy in the year below. So kind of the reason for that is obviously that person has already been through that year, so they know what to expect, and the buddy can go to them for kind of any questions they may have, and they're there for support and advice really.
I think it's really nice as well because on placement, obviously, I was in Southampton for my first year, Emily was there on her third year placement, so on placement you do get to mix with other years as well, so me and Emily got to know each other over the placement, which is really nice, and then you kind of like gain a friend throughout, so that's a nice familiar face in maybe a higher year or lower year that you can always go to as well, so that's really nice.
And it's quite nice having now obviously finished the course, there's people in the department that I'm working in that, I saw as a student and then asking them questions about how, when they first went into employment, asking them types of questions. So it's not kind of just, whilst you're in the university course, it kind of carries on, once you finished as well.
Because one of the things that I think we always mention to you as students is that the cardiac physiology world is quite a small world, and you will meet people. If you move to a different department, you will find people there who you've met other places and have moved. So it's quite a close-knit community, and everybody knows everybody else, which is rather nice. So what would you say, Amy, if I ask you, what did you enjoy most about your first year?
I think first year was definitely my placements. I just like being practical rather than academic all the time. So on placement, the first placement of 2 weeks, the observation, that's really nice just to gather your feet and just get used to what a cardiac department's like without any pressure of having to take on individual tasks or any assessments. It's just sort of an introduction, which is really nice. And then the 6-week placement, where you get assessed on and have to develop your clinical portfolio for. I did mine in Southampton, and the departments are so welcoming and close knit, so you instantly feel like you're part of a family. Everyone's asking how you are and providing support, which is really nice. So that's my favourite part of year one, definitely. Then you get to know people, and you know them for the rest of your career, like you say. It's a small world, so it's nice.
How did you find actually being able to perform tests on patients? Was that a bit daunting at first?
Not as daunting as you'd think. Those skills sessions that we have, quite a few weeks of those, really put you in good stead to perform those tests. And in first year, you're always accompanied by a physiologist who's qualified, so you're never left by yourself, which is really, really nice. So you've always got someone to ask questions to if you need to, if you feel a little bit nervous. They'll guide you through what you need to do to start with before you tackle it by yourself. But the skill sessions definitely give you more than enough practice to be able to go in and confidently perform a test, which I really like, so then you're not too nervous, which is good.
I mean, that's what our aim of the skills sessions are. We always say, if you're going to make mistakes, this is where you make them here, where we can talk you through and you can see what's happened and then you learn from that. So that's the whole purpose of this here.
And I think the good thing as well, that as you go through the years, found that they chuck different situations at you. Obviously they get more kind of complex as you go through the years. And when in your second year, you have something called department day. And so it's run in this room and the previous room we were in, and it's set up like a department, and we get volunteers who act as patients that come in, and you and your cohort have to run the department like you would any other day, and there's some interesting situations.
I was going to say, we give you some interesting things to do.
But there are real scenarios that had actually happened, so if you've done it there practice here before you go out into the real world. So
We prime our model patients to get up and walk out, to have arguments, but it's all things that you may encounter, and it gives you an experience of what's that like.
And that's just before you go out on the second year placement. So that's it's a really good day.
Okay, thank you there, ladies. I'm just conscious of the time, and we've got some questions and answers coming in there. So if you're happy, I can look at those questions and then maybe we can fill them between the group. So lots have been coming in, but what we're going to try and do is throw some of these out now, have some answers, some more come in, we'll try and get to them as well. We've got one question coming in saying, aside from working in the cardiology ward, where else in the hospital do cardiac physiologists work? Emily, would you like to take that one, since you are a new graduate?
When we say kind of cardiology department, there's we can perform tests on the ward if we're going to see inpatients, but then we also see patients in our clinic rooms, and so we see patients as outpatients that come in just for the tests, and then we also in the cath labs are kind of a different part almost from the department, depending kind of what hospital you go to, how big it is, and we get patients, who are elective cases, so they've got planned procedures to come in with, or we may get emergency cases where a patient's, having a heart attack needs to be treated now. So we see kind of patients in a variety of settings. It's not just the ward, or it's not just a clinic room, and every day is different. And yeah.
Thank you, Emily. Here's a question I think Sally could probably take very quickly. Can you prescribe as a cardiac physiologist?
The answer is usually no. It's not required as such. So the procedures you're involved with are diagnostic testing, so you're not usually in a situation where you're going to need to be prescribing.
I would just add to that, depending, I suppose, in terms of what we mean by prescribing. If you're about prescribing drugs, no. If you're talking about prescribing treatment, then as a physiologist, reprogramming a pacemaker is prescribing treatment when you know that the device needs reprogrammed and settings need to be changed, depending how you want to interpret the word prescribing. But as Sally was saying, typically, if you talk about drugs, no. At consultant level, yes. On some of the procedures we perform, we might get on and give patients drugs in a unique situations, but not typically. Yeah? Are we happy with that one? Oh, there's another one that's going to hit Sally first. What's the difference between it sounds like a quiz now, doesn't it? What is the difference between a cardiac and a respiratory physiologist? So if you'd like to do the respiratory bit, Sally.
Yes. Well, as a respiratory physiologist, you're performing diagnostic tests on patients who are presenting with respiratory problems. So we're testing the lungs. As a cardiac physiologist, this diagnostic tests looking at patients with cardiac issues. The two do combine. Obviously, there are patients who have both issues, or where it's not clear whether it's a cardiac or a respiratory issue. And where those combine is where we come into CPET testing, which is cardiopulmonary exercise testing, where a patient is having both cardiac and respiratory aspects measured, and you can work out exactly what sort of percentage of the problem is cardiac related and what percentage is respiratory related. So they are separate. The type of tests you're performing are separate as a cardiac or a respiratory physiologist, but there are areas where they obviously intertwine.
Just to add to Sally there, so yeah, there are lots of areas where we overlap, but being a physiologist is about being a specialist within a particular body system. So Sally was saying, of course, there with respiratory, focusing on the respiratory system, and cardiac is then focusing on the cardiac systems only. Question actually, if I may now, for Emily and Amy, we got, why did you guys pick Southampton?
Me personally, so I did have a little look at some of the unis, but I think the skills labs kind of got me over. A lot of other kind of hospitals don't. Universities that didn't have those facilities, and I think that's kind of vital for your placement to be able to practice make all the mistakes here before you go out onto placement. Like this treadmill that we've got, the echo machine, the high-tech equipment, and so we're very lucky to be able to have access to it. So that for me personally, and the course program, the team are lovely, and you get taught by actual physiologists, who've been there and done the process themselves.
Yeah, I think for me it was definitely the friendliness of the lecturers, and it made me feel like instantly welcome. So I think when you go to visit a uni, you just kind of know if it's the one for you. So when I came to Southampton, I just felt like I'd be happy here, and I live in Coventry, so it's quite a nice distance away, not too close, not too far from home. But yeah, definitely the lecturers and the fact that it's a small course, I really like that personal feel that all my lecturers know me, know what I'm bad at, know what I'm good at, and know when I need help, and that for me is definitely what won me over for this university.
Okay, thank you very much. Next question, are we able to go into the skills lab in our own time?
Yes, there is. We do have timetabled sessions in different year groups. When you are able to come in, we just ask that you book it in advance so that someone can be around here to make sure that all the equipment's working and that it all gets sort of put away and doesn't sort of get damaged or anything while you're here, or you don't get damaged while you're here. So yes, there are definitely timetabled sessions for that.
Yes, absolutely. So that comes down to the individual students to take that initiative, though.
Yeah.
So we have sessions booked out for independent access, but the students have to take the initiative to book that and also identify their own learning needs when they come in to use the equipment and what they need to gain in knowledge during that time. And we do that for each year group as we work our way through the semesters. Fantastic. How do I become a cardiac physiologist specialist? So, Emily, you're starting off and you mentioned about progressing and specialising. So what has Southampton said to you about becoming a specialist?
Yeah, so I think, as I said earlier, some people maybe like to start more general, or some people like to kind of maybe go down the non-invasive or invasive side, but I think it's just a gradual progression. I've chosen to go down the invasive side. So I guess in that term already, it's a specialist area, invasive or non-invasive, and then as Sally said about the banding systems, once you get up to a band 6, obviously that comes with more responsibility and more a greater role, and as you go through the bands, band 7 and band 8. But yeah, I guess specialists, you're performing more complex procedures. You've got kind of more knowledge of these procedures, and you start to teach people, less senior people, maybe band 6s, band 5s. So another that kind of comes into the specialist role.
Let me throw another question in, if I may. Did you go for a fast track post?
I did, yeah.
So fast track posts are becoming more and more common, where departments obviously need to run a service and have to meet the demands of the service. So sometimes when you apply for a job, you'll be offered a fast track, in which case you could be specialised earlier. If you don't want it, they won't necessarily make you do it. And some students go into posts where they still do all areas of cardiology, but there is an opportunity to fast track. Fantastic. Thank you, Emily. How easy is it to progress as a cardiac physiologist in terms of bands?
I mean, we're quite a small, as you say, like Rendermarm, quite a small workforce maybe compared to physios and nurses, so there's more kind of opportunities to progress quicker.
Yeah, so like Sally said, you're only at band 5 for maybe a couple of years before you go to a band 6, and then if you want to take on a more senior role, more specialist role, then you'd go up to a band 7, where you kind of like maybe teaching other students, other band 5s, a bit about their speciality. So it's definitely an opportunity, and it's relatively not easy, but there's the opportunity to progress quickly as well, which is good.
I think, Sally, you were referring to one of our graduates is now going for a band 7. that may even be in that photograph.
Yes, indeed. I say our students sort of move up the scales sort of only after a few years in each place, consolidate their knowledge, and then they'll be applying and gaining the next band. So we've seen students here within, say, 4 years of graduating who are band 7s.
And it is phenomenal. And remember, I mean, I'll use Emily here as an example. You know, with Emily taking this post on in Southampton, she will be supported, nurtured, loved, because they want to hang on to her. And that's why they pour so much resources into training and looking after staff. And coming back to what Sally was saying about career prospects in terms of flexible working, all those hours type of things, because they want to keep you. That is the whole point. And the other thing, just to add to that, that's why they want you on placement, because they want you to come and work in their departments, because they have a service to run, and they can't run the service without people coming in as graduates, band 5s, and working their way up through the career framework. Another question's come in. It says, how easy is it to get a job on graduating? Emily, I'm looking at you.
I mean, I secured my job, I think around March time, maybe March, May time. So, I mean, you know, we didn't actually finish placement till July. We don't actually graduate till December, this coming December. So it's, you know, I'm not saying it's easy, like, you know, you obviously have to go through the interview and an application process, and, you know, during my interview I had to do an exam as well, so, you know, it's not easy, but there is definitely a lot of jobs out there kind of waiting for you to go into.
I think just to add as well, where Emily came into Southampton, and if we take another student I can think of that went to Cambridge, a lot of that comes down to when the departments advertise. So every trust is different when they, you know, get approval for funding and go out to advertise. It's quite a complex process for a department to do that. So the departments have to sort of get in quick, you know, to get students employed and on board. And we're seeing that they're actually putting their adverts out earlier and earlier every year, because they're just getting into the swing of things about when the graduates appear. So hopefully those two things will align even more closely as we progress. We've got another question. Are there cardiac physiologists who look after children? I'm presuming they're not meaning their own. Paediatrics.
I mean, yeah, I think that's a whole other kind of subspeciality. Like, adults and paediatrics are very different, and so I think you know, kind of with the technology, it's always kind of improving. And like Richard was talking about the 3D scans, and we use like the echoes to guide interventions as well. I mean, I guess it maybe depends on the hospital you go to as to whether it does like paediatrics, but there's definitely that option if you want to go into that. Did you experience in your placement?
Yeah, so I got to spend a bit of time in paediatrics in first year at Southampton, because I've got quite a big paediatric department. So you get to go various places. I went on to the children's wards, the outpatient department, even went to paediatric intensive care, which is, yeah, a really good experience. You see such a range. Obviously paediatrics is from newborn to 18 years old, so one patient could be a baby like 6 months, and then your next patient could be like primary school age. So there's lots of variety in paediatrics. So yeah, it just kind of depends whether you like paediatrics or talking to adults.
And again, just to where Amy has been in placement at Southampton and Emily's here, of course Southampton, where we are, is a regional centre. So that's why you see much more diverse, complex cases. Now, go outside of Southampton, other trusts will still see paediatric patients. They can't all come to Southampton. And we have sort of grown-up congenital patients now. And once, let's say, they get past you know, certain treatments and things like that, they are, you know, handed back to other departments to monitor and look after. So if you're not in a regional centre, it doesn't mean you won't have experience of paediatric patients. And you see that in DGHs, district general hospitals, and all sorts. Okay, now here's a question we've never been asked before, so we'll go for it. Are there any disadvantages of being a cardiac physiologist? I don't know. That's a good question, isn't it? I've got one answer. One thing I found when I became a cardiac physiologist, you spend so much time on your feet. The first week, my feet were killing me. Absolutely agony. So the moral of the story is, Sally?
Buy good shoes.
Has anybody got any other disadvantages of being a cardiac physiologist? Have we found any
I
yet?
haven't found any.
Pretty like standard working hours, so that's not a disadvantage. You're not like on shifts all the time. You're on regular hours, which is good.
I can only find advantages.
Yeah.
Any disadvantages, Sally, you can think of?
As I say, it's a fascinating area to be working.
Or I can think of another one. So we've done the feet. So since you've started this course, and Emily, you've graduated, have you become the family spokesperson now for disease or cardiac disease? Everybody comes to you now when so-and-so. So whenever you have a relative coming or a friend, they always want to come and ask your advice. Definitely. Okay. So I think that is, I can't see any more questions coming in from our attendees. So, and we are past 4 o'clock now. So what we're going to do now is basically just thank you for your time this afternoon. And it's up to me to say thank you to Sally, Emily and Amy to give up their time and join us this afternoon so we can get across to you this amazing world that we live in. And what I would just like to add to that, we're also very privileged for what we see and what we get to do. And being a cardiac physiologist is just an amazing role. And you can't really appreciate that until you get here and you're doing it. And then you go, wow. So what we want to do is say thank you to you, but also say whatever you do decide, we wish you well and good luck with your future careers. Thank you for your time.
Thank you.
Thank you.